The Health Justice Partnership is called ELSA, ELSA. That stands for Engaging Living Safely and Autonomously. It's a health justice partnership between Eastern Health and Eastern Community Legal Centre to work together to prevent or to stop elder abuse from continuing to occur within the Eastern region. Elder abuse is a form of family violence. So often it is perpetrated by an adult child towards their older parent. It includes financial abuse, physical abuse, emotional, psychological and verbal abuse and intimidation, and sometimes it can also involve sexual abuse as well.
Well, I'm a geriatrician. It's an unfortunate fact of life that I encounter patients who are experiencing elder abuse. In medicine, it's very important to practice within your scope of practice, to practice in areas where you're competent and to recognise where you need help and where to get that help. Elder abuse example is one of those areas which is right on the edge of most health professionals' scope of practice, and so we can suspect that something's not quite right but not know what are the ways of dealing with difficult legal situations. And so having legal practitioners available who can help unpick certain problems, that's a very valuable resource.
Sometimes patients aren't aware that it is elder abuse until we do speak with them and I guess help them understand what elder abuse is. When the patients do disclose something to social workers, we support them in getting help, and most of the time they do accept the help. And one of those things that we do is say there is this group that can support you, and that is the ELSA program, and they are the ones that are there that can speak to you confidentially as well and walk through what the process will look like if you did need some support.
It's very common for people to experience social issues that really take far more priority over, what we would see as their legal issues needing resolution. And so being able to see somebody firstly in a safe space that Eastern Health are able to provide, not just physically but also emotionally, because they've already engaged with the social workers and the doctors and the nurses. That's one element of why it's so beneficial. The other element, of course, is that having financial counselling, having the support of a social worker and also the support of a community lawyer all together are able to respond to a client's numerous, multifaceted sort of needs. It's completely understandable that people don't want to see a lawyer by themselves, but if you are surrounded by trusted professionals such as the Eastern Health staff who have referred you to what they believe to be a trusted health justice partnership, you're much more likely to take up that referrals.
He was very controlling. We could never criticise him for anything or we would get bashed. We couldn't leave credit cards around. He's emptied our bank accounts completely. Stolen all the jewellery. Sold tools, anything of value. Even if we had bought something and brought it home, still in the box, it was gone. And just smashed the place up as well as us. As I say, as parents, you live for your children. And you think it's going to get better, but it didn't. And that was the realisation that we just had to get him away from us for what we've got left. Well, when I spoke to Paul, I told him what had happened. He kept reassuring me that there had to be something that was going to stop him and that we did do the right thing. And I guess subconsciously we knew that we had done the right thing, but to have Paul there, he was great.
Over the course of ELSA's operation, clients often report that they feel more empowered in that they understand what their legal options are and also what their financial options are as well.
Well, this has been a very good partnership between Eastern Health and legal practitioners at the Eastern Community Legal Centre. It's borne fruit for individual patients and it's helped practitioners to practice with greater confidence. There are people in the east of Melbourne who have already benefited and more that could benefit on an ongoing basis.